Oga for office, Oga of Edo East, will be Edo Health Insurance Scheme. So today he will tell us what Edo East is all about and how they don't affect people of Edo State. Good morning, sir.
Good morning, madam.
Welcome to Oberland TV. Today you will tell us what Edo East is all about. How una fit affect the people of Edo State and how una fit take affect those people will be saying never register with una. So you will tell us.
Thank you very much once again. Good morning, madam. Edo is just as the name implies. Now Edo Health Insurance Scheme. Alright, Edo Health Insurance Scheme now part of government where they buy health insurance or will buy health for people. Then on behalf of them, we'll go to settle with the health service provider so that anytime they fall sick, they will go to the hospital. They will pay very small or no amount of money. Now, we started this Edo Health Insurance Scheme. We started for 2019 through House of Assembly. Then our governor come to sign them into law. So after we start, a year after we start, they go around everywhere. They tell people what health insurance be. They say health insurance now where everybody go put small money for inside pot. So that when anybody they sick, but we know especially everybody will sick at one time. So that when anybody they sick, we'll collect that money, we'll put for that pot, we'll take care of that person. Because we don't do one thing where they call statistics. They say if you do them for the health insurance space, you will not expect more than 20 or 30% of people will sick at every point in time. So it be like a form of communal living where everybody will contribute small. Then when a particular sector of people sick, you will use and treat them. So now we take Edo State Health Insurance Scheme they all about. So if you look at and those the money where they pay yearly now small money, ticket money. For example, the payment rate from 18,000 up to 75,000 yearly, and they take care of various things from cesarean section to malaria treatment to eye treatment to surgeries and even orthopedic treatment. You know now this kind of small money where you go pay so that when anything happen, if sickness come for night. You know, they don't say, hey, where I go see money, who will give me money to take care of my people. So people will get family abroad. And this kind of thing they're supposed to buy for their people. Go buy insurance for their papa, go buy insurance for their mama. So that when their mama or papa sick, they'll go to the nearest facility who don't look, say, okay, they meet a particular type of standard, then they will get better quality of care for our people of Edo State.
Okay, thank you very much, sir. Who and who go feel register for this Edo East?
One thing where they call mantra will be one of our pillars for Edo Health Insurance Scheme now say everybody for the state they call an all-inclusiveness. Nobody is left out. Everybody for the state. Our papa they involved, our mama, our brothers, our sisters, our cousins go there. People who no get money, we not get money go still they involved. Men and women, people who they different political party, whether it be Muslim or whether it be Christian or whether it stay village way far. Everybody supposed to involved because this Edo Health Insurance now for everybody, irrespective of whether you get money or whether you don't get money. We don't do the process so that if you fall into any of these categories, you go see where at least you fit get health care. We go make your life better. We go make your health improve.
Okay, now thank you very much, sir. Oh, you mentioned 18,000 to some particular amount just now. Now, which category fall for all these people? Will be say these students. Children, old people, which amount they will fit pay will be say for that year where they will fit get that free medical treatment. Because if they don't pay now, if they fall sick, now free medical treatment now they will come take like that. Abi?
Yes.
Okay. So which amount, different amounts will be say who will fit pay 18,000, who will fit pay 30-something thousand to take the register?
Okay, thank you very much, madam.
Okay.
That's a very beautiful question. You see? We talk say this is our health insurance scheme now for everybody. We can't look the society, we can't say now different classes of society now we can't begin to divide them. We first talk say for people who don't get money, we can't call that plan the equity plan. So that equity plan now federal and state government will put money aside to say for this year now the amount of people who will cover. And in their graciousness, those state government and federal government can put money together for this year say they will cover about 45,000 people free of charge, which is called into the Basic Healthcare Provision Fund or the Equity Plan. As at present, we don't cover about 29,000 people for this year. We still get almost about maybe 11 or 16,000 to make up that 45,000. we'll divide them across 18 local governments. Everybody will be represented. We'll take from various groups, people will be desolate, people will not to get money, people will not get that financial well without, all right, to take care of those people. So that's one called the BACPF for equity plan. Another plan where they did, the plan where they call the formal sector plan. All right. So that formal sector plan, they take care of private organized sector, such as banks, companies where they very corporate, or even the government as we did. So we calculate that plan to be 3.5% of their total annual pay. All right. So what think government do? Government for those states try well do. They contribute 50% of that amount. Say anytime you fall sick, they don't want just know say you know get money this. So government say if me when they work for government say I get 20 naira to pay for healthcare, government will add 20 naira join to make sure say I sick, to make sure say I well. So what think government can do? We can deduct 1.75% from their salary. Government can say go add another 1.75. So every month our Edo State government will start, and so they pay for all the people where they government where they work with them. If they pay for the people where they work with government, if they pay for their wife, you also they pay for 4 children where they less than 18 years of age. And I will tell you, those state government they do. They take care of father, mother, and 4 children. You see, that's another plan. So we don't talk about 2 plans. Another plan where they say they call them student tertiary plan. That plan are people who don't finish from secondary school, where maybe they want to go into tertiary institute, or that's university, polytechnic, or they want to go learn work. Where especially at that age, from 18 years, you are trying to get independence to do all these things. So those people, their plan are 18,000. If you dey school, they go out and join your school fees. If na work you go learn or you dey work for anywhere, the person will employ you and you now contribute to now pay for that plan. Alright? So that's the 3rd plan. The 4th plan, what they call the informal plan. Now that one where a lot of people for the society, people who know they work with government, people like mechanic, artisans, who get their own company. Market women, you know, hairdressers, restaurant owners, you know, freelancers. Now that plan, that they call informal plan. Okay. But that plan we can't divide it into 3. We can't say if you earn less than 50,000 a month, it would make you buy the plan of 18,000 naira. Okay. If you earn between 50,000 to 150,000, it would make you buy the plan of 35,000 naira. Now if you earn above 150,000 above, it would make you buy the plan of 68,000. This is what we do and say, not be everything insurance if you cover. But we talk and say for our society and for all over the world, the best industrial practices, what thing that they do and say, if they want to measure person health, the reason why they say they know the person health good or society health good, they call it maternal mortality index. And so because of that, across all our plan, whether you pay 18,000, whether you pay 35,000 or 68,000, we cover all cases for maternal health. So if woman come our house, for example, in one born, he can't enter CS. If na private hospital it is, private hospital nowadays na 300,000 they collect for CS. With that 18,000 wey you pay, you still get your CS. Alright? So that one na the 4th plan. The last plan na the private enhanced plan wey cost 75,000. That one get many things. We dey advise for people wey dey abroad, may they keep to their family because I think they get 2 home visits inside. So every year our nurses go those people's house, go look their drugs, go take their blood pressure. They'll do it twice a year. Because now they call private enhancement because more benefits there. But that one only say if you buy the other plan, you don't physically go the private enhancement. You just add money join because you want more health benefits. For our papas, our mamas, we don't old because they go hospital frequently. Now that one they advise them make they buy. For our people who they abroad, they want buy for their parents. Now that one they advise make they buy. For people who get some kind of sickness, now that one they advise make they buy. If na sickness we know if you take care of before they enter the scheme. We'll first check their body, we'll try and say this sickness never there, but from the basic ones there, so that when you reach us to, you know, doctor will take your money and we'll not gonna give you the thing what doctor will give you. So anytime before we take person, we will show them all the things what they do. Alright? We say for now, we never start to treat many things like cancer because we just start for 1 year. As we grow, we'll begin add other things join, alright? Like this year now, as we don't do for 1 year, we don't add many things join. We'll go around the hospital, we'll say which sickness people they sick fast for hospital. What did they affect our people for the society? What did they affect them for not? What did they affect for those central? From that data we don't collect, we'll come back, we'll come the add and join say okay, they need this, they need that. So now so they make our health package, they grow every month. And the good thing about our health insurance, not all health insurance they do for Nigerians, say whether you be private provider or you be public, as long as you meet our prerequisite, our standard, we don't say now you go meet before you start to give us care. we employ you onto the scheme, and we dey make sure say we dey monitor you so that our enrollees no go dey suffer. When they come out, they no go wait for 2 hours before they see doctor. When they come out, you no go say me they pay 100,000 instead of me they pay 5,000. Now those kind of things now they do to make sure say the scheme work and everybody go happy for wetin government don do for our state.
These hospitals so wey be say una dey work with, may I put am like that. E get amount wey dem go pay to take register under una, abi una dey pay them. How una take dey do that one?
In fact, this question where you ask me suits me well. Now the first time anybody don't ask me this question in all the interviews where I don't get. You know, again, I'll talk about best industrial practices.
Okay.
Usually, when people want to join health insurance scheme, you as a regulator or a licensure, they will come with you, they will come pay. Okay. All right. But what we do now, say because insurance they relatively new for our country, even the providers don't really know how to run them. So we brought it new. When something new, you have to let it settle in. We didn't collect money from these providers in the first year of service. Okay. Usually they're supposed to pay for accreditation, right? Usually they're supposed to pay for accreditation today on the scheme, but we didn't collect money from any of them. But we are hoping that from the second year moving forward, they have to pay for accreditation, they have to pay for what kind of services they will give, either primary or secondary service. But beyond payment, they will give us, which one will be ticketing money. All those standard rules don't set in terms of the governance. How many nurses did there? How many doctors did there? How many laboratory technicians there? How many pharmacists there? All right. The building, they get water. If they take light, they get solar. They get generator. Security man did there. The road to reach the IB. All right. They get cold storage. They treat children for immunization. They get out to treat. They will tell people, say, now what you go do? This is the kind of exercise where you go do. This is the kind of food where you go chop. All right. They reach out to their patient to tell them follow up, all those kind of things, you know, beyond payment. Now we want to make our people wait there to our health service provider they give to our really. One thing where those state health insurance they always talk and say, well, they very big on and say, we they call one thing, one mantra called positive enrollee experience. So if you go through all our facilities, we get people that they call enrollee experience officers. You know, just like if you go bank, as you enter, person will say, good morning, ma, good morning, sir. You know, as you enter, that thing don't change your mindset. You go begin smile, you go begin happy. So even if they treat you, even if you know well, but you know, say these people, they made an effort. They're friendly. They treat you well with respect and dignity, and you know. And so that's what we are trying to tell all our people, all our providers, and say, may they treat our people with respect. Health is not just the absence of disease, all right, but a psychological state, that a stable state of mental state, physical state, even financial. Yes, we know if we give una money, we wanna come, maybe if we need money. But we go feel great una. Go feel say you say, my brother, my sister, my pikin, how you dey? Don't worry, this thing where they do, you go by God's grace, go finish. Just take this drug like this, come see us again if you not go. Before you know, the person in mind go they sweet am and the body go well. You know we need to come hospital again. Alright, so this positive and enrollee experience now we dey try to on all our facilities. As of today, we have about 162 facilities. We are hoping that the more people they join, we they add more facilities onto the scheme so that it will be widespread across the 18 local governments of the state.
Okay, 2 questions to answer. These facilities una dey use so, una don't tell them say this first year so una not collect money for their hand, but this second year una go collect money for their hand. That one aside. Then all these treatments wey people una get, which type of treatment? Malaria, people, all those old women where they sick, joints, pain, then when they do operation, which kind of treatment you now get for these people? Just mention them so that our people will know, say, if I register under this insurance for health, I will know, say, if I get malaria, I will run there, go take treatment. If I get other sickness, I go run there. So which type of sickness now they treat generally?
Yes, thank you very much, madam, for that beautiful question. For Edo State Health Insurance, you see, they say, we go they talk and say you do not give what you don't have.
Yes.
And so now the services we do within our environment, we do within our society and our local community, now we they first give, alright? They say common things occur commonly. And so now those common ones now we they do first.
Okay.
Alright, we they treat people who get headache, who get malaria, people who want born antenatal. I talk and just and say, women, we don't want to make any of our mama, our sisters, our wives, we don't want to make them die.
Okay.
When God don't give you gift to born, you go born, you go and die. We don't want to hear that one at all. So across the spectrum of maternal care, we treat all the treatment for free. All right. If people get surgery, maybe they get hernia, they get prostate, we also they treat them. You know, those are the treatment based on what you get. If na life-threatening emergency, we will treat you for completely free. If na waiting will cost, maybe you will lose your hand or you will lose your leg, or we'll treat you completely free. But if na some cases, maybe when you get some slow-growing tumor, for example, a woman get fibroid now, we will say, okay, bring some money, we'll bring some money, we'll treat them together. Because fibroid not waiting go happen, it might be emergency, we don't see am over here, so we expect the person go don save some money. Some hernia, for example, wey not there the emergency, wey dey grow small, they expect say they go supply some small money. Prostate cancer too, they will supply some small money. You know, so various treatment dey, but the kind of treatment we will not dey do for now. Now say we not dey do many cancer treatment. Like I tell you, cancer treatment dey very expensive, and because we dey in our first year of operation, we say as we dey move forward, maybe from next year we'll come add and join. We know they do a lot of plastic surgery. Maybe man or woman will come say you want make you get flat belly, or you don't want make your hand too big, no reduce, and the one wey they do for abroad, wey they say for fine body, for we know they do that one. Now treatment we they do, because for our country common things occur commonly, and so now only the illness wey people they get every day now we they treat. And for our skin, to one of the beautiful things I say, we they also do investigation. The way people they do health check every year. In fact, before you enter the skin, they'll first check your blood pressure, they'll check your blood sugar, they'll do one thing that they call urinalysis. Those things that they call them point of care testing. But as a drum, if you put the dipstick inside your urine, when you look at different color will show. It will show whether the person get infection, it will show whether the person get red blood cell inside your urine. So all those things now point out to say this man will quick fall, he will soon fall sick, or he don't dey sick. Maybe we quick treat him, maybe we quick catch the treatment so that it no go worsen, so it no go destroy the person. You know, that's what we do for our health insurance scheme.
Okay, thank you very much, sir. This is one way I want to ask you. You know, they trend for some parts of Nigeria. You say some women will be saying they not feel born. They call them the way they say they'll go third person, another woman say make born for her. What they call them surrogacy. Now, this insurance it cover them. Okay. Because some persons they talk say insurance supposed cover surrogacy, and now that one they come well. Although it dey happen before, say person go your other person make born their hair, but insurance cover them. This one insurance cover that one.
Okay, thank you very much again. You know, like I talk, now small we go dey grow. Okay. Surrogacy na a form of very specialized treatment. Okay. And don't forget the laws where the guys surrogacy for Nigeria never really dey concrete. Okay. And so we dey try to work within the ambits of the law. But first thing, as a medical doctor, as a family physician, I will tell you that about 60 or 70% of case of infertility, now because the people don't know when to meet, all right, and so insurance they tell them that there's something they call ovulation period for women, yes. All right, there's something they call azoospermia for men. Okay. Maybe their sperm not they move well. Okay. Some of those things you can treat it before going to the last one will be surrogacy. Surrogacy, and I say you don't try other things, so you don't tell them when to meet, when they not be safe period, when be safe period. You don't tell the man to avoid cigar, to avoid alcohol, to drink plenty water so that his sperm will good. Now when you don't do all those many lifestyle modifications, you know, you don't say and say that one not work before you go other ones such as IVF or surrogacy. Okay. For now, insurance will give you advice, you know, reproductive advice when you meet, when can you meet your husband, the things that you avoid to prevent loss of motility in the sperm, the things where you will do to make sure say you know, your body do well, the kind of exercise where you going to do, insurance they tell you all that now. After we move from there, we'll go IVF before we go surrogacy. So presently, we are doing the counseling aspect. Okay. Maybe after a while, we'll go IVF, okay. And then hopefully before we go surrogacy, the laws guarding surrogacy go down the concrete. Make people not on the fight, say, and so we talk before we start, or not so we talk before we start. So the laws on surrogacy here is still watershed. We never concretize them. Until we're able to concretize it, it's not something that we intend we will get into.
Okay. Thank you very much, sir.
Thank you very much.
So you will tell our people, both from home and abroad, small advice. Just give them small advice.
Yes. Again, I want to thank you very sincerely. People of the journalists, you know, una be our very important stakeholders. Now they send this our message to our people, make them know what thing they happen. Because sometimes we both talk say perception is better than reality. Now only what people know they go fit talk about. Now only what people know they go fit improve. I want to use this medium to tell everybody, our brothers for Benin, our brothers for Lagos, within the country, African continent, and outside the African continent, where they abroad, say insurance na win-win for all of us. Insurance good for our papa, good for our mama, good for our brother. Imagine situation where you go pay ticket money, but you get benefit wey make gbagada. You know, na so insurance be. You no go wait make you sick first before you come dey run up and down, because at that time they'll say it's too late. So they say make hay while the sun shines. Now that you never fall sick, if na small money every month they contribute am to say na this one out there they do insurance. These things don dey happen for abroad for almost 100 years. You know, our brothers and sisters will go abroad, they'll say when I sick they treat me for free. Nothing in life is free. Person they pay for it. And because they don't they collect contribution from their salary, they make their own they work. And so we are begging our people. We are also endearing them to say that health insurance is good for you, it's good for us. Make una try take out of una small contribution. Wetin una fit do monthly, wetin una fit do yearly, so that when this calamity or catastrophe occur, which must occur at any time, when person born, when person come life, he must die. So sickness, no guy one day must come. So that when he come, you know the wrong letters get and say, hey, where I want to see money, oh, my brother, where there, God never send me money, who go help me? You just set free, just walk enter house the way they don't put you. You go take health insurance for free, and you'll be well and back to optimal function in the nearest future.
How these people will they register?
Okay, we get various modes of registration. We can register at our various healthcare facilities, also in our office and secretariat, civil secretariat building, block C, on the 6th and 8th floor. We have customer service ready to attend to you. You can also register on our website, edic.edostate.gov.ng, where you can also do some self-enrollment. Alright, so we can also register using our automated call service. We get what they call automated call service, and once you call, it will take you through the process before you register. You'll catch up and you join the scheme. As soon as you register, you'll get an automatic SMS, what they call corporate insurance number, and then after a couple of days, you'll get another SMS where your hospital is, then you'll get your card. So the registration process is seamless, but if you have challenges, please come to our office. I repeat again, on Saple Road, Civil Secretariat Building, Block C, on the 6th and 8th floor, Benin City, Edo State.
Thank you very much.
Thank you very much.
All my people now so will come ahead this interview with the DG of Edo Health Insurance, Dr. Rob Amegor. So we're not here for now. Insurance, health insurance good very well. You will be abroad. You will be Nigeria here. So make it try, come register. Put your children, put your papa, put your mama. People now register so that you now head, you now go feel a follow up from your head. And if you now register with small money, if anything happen, now we won't go to the hospital. They will treat you for free. So that people are not here. I salute you. My name is Jessica.